She's on several different medications. I brought my dog Dixie with me today because we are going to talk a little bit about senior pet care as well.
Sure.
This is Dixie. She bye Dixie. Dixie's a 14-year-old German short-hair pointer. She was the first pet that we got as adults. I say we. My husband now, we were dating at the time, got her our senior year of college. So she is 14 and we've had her since college days, and as just like she's bouncing around here, she is, my grandma used to call her the bouncy dog because she is very energetic. She loves people, she loves to socialize. Unfortunately, like I mentioned, she is 14, so she's starting to have a little bit of dementia, and she definitely can't hear as well as she used to. So that's another thing I think we are going to try to talk about today is just senior pet care and dealing with dogs as they age. And it's a sad thing, it's a frustrating thing. I've been through both with her. I have her and another dog, Macy, as those are the two dogs I have. I also have a kitty and two horses. But Dixie, over the last probably 1.5 to 2 years, has really started slowing down. We noticed one day she was out in the horse pasture with me, and I called her, and she completely ignored me. And honestly, she got in a little bit of trouble that day because she did not come when she was called, and you know, when she's around the horses, it's very important for her to come. When she's called her, she could get herself in trouble. She could actually get hurt.
It's
so
okay, baby.
we kind of had a lesson about here, and 2 or 3 days later, I realized we were in the house, and I'm like, I don't really think she can hear as well as she used to. So we've adapted, we've changed. She doesn't really get to go to the barn as much as she used to, unfortunately, just for safety reasons. If the horses are shut up, she gets to go with us. But she also has started having a little bit of dementia that we noticed. Random things here and there, but the biggest thing is she started where she would get up in the middle of the night at 3 o'clock, like every morning, and she would just get up and pace. And unfortunately, we were able to put her on a product called Life that actually has helped her quite a bit with her mental focus. She's not a puppy again, obviously, but she sleeps through the night again most of the time. So those are some things. As you notice, when she's walking around here, she slips on the floor quite a bit. So she's on several different medications. Sorry, Dixie, come here, sweet girl. She's on several different medications that help with her joint and orthopedic function. Dixie, maybe we should put you back on a leash. Come here,
do you feel like the Life is helping her?
I absolutely feel like the
What do you think is
helping.
Does she have a personality change since she's still the same dog, but she's...
It's weird. It goes back and forth. She is still goofy, happy, bubbly. She wants to play, but then as far as it's probably more of her physical limitations than anything. She used to be the most cuddly dog. She would get in the weirdest places just so she could get on the couch or in the bed and cuddle with us. And now she's like, I think I'll go lay on my own bed.
Yeah.
And I really think that it's more like she wants to lay with us. She begs to get on the couch. We let her get on the couch. Yeah. And then when she does, she doesn't seem like she can get comfortable.
Right.
So, but she's very happy. She's still, I'm sure that if we took her to the pond, she would want to go swimming. We're pretty careful with her just because we don't want her to get injured. And, we want to keep her as healthy.
She do a lot of pacing like that at home?
She absolutely does a lot of pacing at home. Not in the house so much, but you notice she is actually a little bit skinny. She's always been a thin dog. It's just her breed, her body type. But she has, over the last 6 months, I think we've noticed that she doesn't have as much. She actually truly looks like a thin dog now. And there's little paths in my backyard. So we have a fenced-in backyard, and that's where, if the weather's nice, that's where they stay when we're at work. And there's little paths, and she makes the same path over and over and over. And if we're at home and we're outside doing something during the day, we have noticed her. Like she just makes those laps. So hey, baby, come here. You want a cookie? Hey, look. Calm down. Okay. Look, Dixie. Look.
So you're happy with the profession you've chosen?
I'm very happy with the profession I've chosen. It gives me the opportunity to to work with animals every day. You know, a lot of people think our profession is playing with fluffy puppies and kittens, and as you know, it's absolutely not. We get to do that sometimes, and those days are a lot of fun when you get to see a lot of puppies. Unfortunately, you know, we do also see sick dogs, old dogs, but it's still, you know, it is part of the profession. It's part of the profession that we chose, and it's part of having pets and having a life, is that it's the whole life cycle. You get to see the fluffy new puppy, and then you go through the whole life, and it's a lot of fun when they're puppies. It's gratifying too, as an animal lover and as a pet lover, and as you know, the pets are truly part of my family, to be able to help people go through that process with their pets. As sad as it is, it does make me feel good to know that I can help somebody make their pet's last day better.
Yeah.
You know, it's never something that we want to do, but it's unfortunately something that we have to do.
Yeah.
And it is something that I've always been kind of passionate about, because I did grow up on a farm. I understood from very early in life that losing animals is just a fact of life. It's okay, baby. Look, you're okay. Do you want to go see Emma?
Helping people really is nice, because
Absolutely.
I've been around long enough that we've been through several rounds of pets together. You know, thankfully we've outlived that first round of pets. So, but it's hard. It's the whole circle of life. It is the ups and the downs, and it's amazing. So it's good, but it's bad, and it's just part of what we do. It's part of having pets, and so it is hard, because a lot of times when someone loses their first pet, it's the first loss they've ever had in their life too. And I think that's important, and it's really our responsibility to be there to support them. And you know, a lot of people ask me, is it cruel to put them to sleep? That's a question that I get a lot, and I'm sure you do as well. And absolutely, I don't think it's wrong. It's a decision that we can make for pets that we don't have the ability to make for our human family. And I'm not saying that we should, but it's you know, you see humans suffer and go through things, and you know, our pets don't have to suffer like that. I mean, I personally saw my grandfather go through a stroke, and he was he grew up on a farm, and he didn't go to doctors, and he liked his independence, and he never wanted that. And I think my grandmother got afraid when he had this massive stroke, and she said, you know, we got to save him. I want you to put a stomach tube in and put him on the ventilator. And then once he was on that, they couldn't take him off, and he went through a terrible last year of his life that he would never have chosen for himself. And so I'm not saying anything political about what we should do with humans, but I'm saying for animals, I think it's the kindest gift we can do sometimes.
Absolutely.
But it's very hard for people to make that decision, and it's very hard to know when to make that decision. And I think it's different for everybody. And I think it's we really have to respect. I think if you have a friend who's going through it, or if you've been through it, and you have to respect their place, because each person deals with it differently. And I know when I've lost pets, I mean, it's a tragic loss, and you feel a terrible emptiness, and people tell you, well, it's just a dog. I'm like, well, it's not just a dog.
It's not just a dog.
You feel it inside. It's a measure, you know.
Yeah, absolutely. Yeah, I think you're absolutely right. I mean, I also saw my grandfather go through severe dementia, and you know, we got to a point that we had to choose for him whether to do the feeding tube or not, and we knew that he wouldn't have wanted to do that, but it was hard to see that. But going back to the pets, it's every individual person has their own threshold, and I think different people have different thresholds for different pets. And I think whether that's an attachment thing, whether that's you know, I put my other dog through this and I don't want to see this dog suffer, or you know, whether, you know, it's just every single decision is individual. And I have people ask me all the time, what would you do? And it's not an answer that we can make for other people, but we can kind of talk about the what ifs of different scenarios to help make it as easy as possible. So I was actually talking to Emma and Sophie earlier about how with us trying to do the multimodal pain management and fear-free, and we do all of that here already, and I would like to look into doing a hospice type course to learn more about that and pain management, to make everything easier for the end of care. And that's what I was talking about. Dixie, actually, we've got her on 2 different medications to help with discomfort. She's actually on
3 different medications and a special food right now. So
Oh,
she's on the Royal Canin Mobility food. She's been on that for, gosh, probably 6 or 7 years now. And then she takes the Life to help with brain function, and then she also takes gabapentin to help with pain. She's always not been tolerant of the nonsteroidal anti-inflammatories, so that's something like Deramax, Carprofen, some similar to us taking Aleve or ibuprofen, but they're specific drugs to dogs.
So it upsets her stomach?
It always has upset her stomach. Even when she got spayed at 6 months old, we took her off her pain meds because she had such bad GI upset that I'm like, well, she's more miserable with that than she was with the discomfort. So luckily, I switched her this week. She got to the point that the gabapentin wasn't helping enough, and you could tell that she was uncomfortable. And so I added Galliprant, which is a fairly new non-steroidal anti-inflammatory. And she's been on that for about a week now, and knock on wood, it has not upset her stomach, and she seems to be doing a little bit better. So that's good. And those we have so many options available to help make them.
That's kind of what dealing with senior pets is. It's really it's a lot of juggling of medications sometimes to find out what makes them feel comfortable, what makes them too groggy, what they can't tolerate. We got to experiment a little bit.
Yep, absolutely. We have to experiment with that, and we typically like to do washout periods between different drugs, but sometimes that's not necessarily feasible for our older pets. We need to keep them comfortable. So sometimes you talk about a risk of benefit, whether it's switching from one drug to the other, or we know there's a little bit of kidney dysfunction, but they need to have this medication anyway, and their quality of life is so much more important than their quantity of life. I mean, of course, we try to make their life as long as possible, but we have to think about making them comfortable as best they can while they're here with us.
Sure.
And you asked about her personality. I mean, she still seems very happy. She knows us. She wants to eat treats. She eats, like, she will steal her sister's food if her sister lets her. That doesn't usually happen because Macy's like, nope, I'm eating my food first. But yeah, she's happy. She likes to go outside. She likes to play. So
well, that's good.
So that's great.
Your care. What do you think people should look out for as their pet gets older?
A lot of things that I think it's important to watch for: changes in their behavior, changes in their appetite. One thing, if you have steps in your house, I think that's one thing. Going up and down the steps more slowly can indicate that they may be starting to have some joint issues. Or, even as I mentioned with Dixie, she used to like to cuddle no matter what, and then it's like, oh, Dixie wants to lay on her bed. She doesn't want to get on the sofa. Like, appetite is really good. Changes in weight, changes in their hair coat. A lot of times they don't groom themselves like they used to. So, and I mean, nutrition and the way they metabolize their food plays a whole lot of importance in the way they look externally too. So their outward appearance can tell you a lot about what's going on the inside as well. But some major things, like I said, getting up and down off the couch, going up and down the steps, whether they want to get up or not. A lot of times, if you're used to your dog being under your foot when you're cooking dinner in the kitchen, and then all of a sudden, hey, where's Dixie been the last week when I've been cooking dinner?
Yeah.
Like, she's probably happier laying on her bed than being there. And that is another thing, actually, that I've seen with Dixie. She used to be the one, like, begging for food in the kitchen, even though she really seldom gets people food. Not saying never, seldom. But she would. She always liked to be in the kitchen with us when we were cooking dinner because she was with us. And now she's just as happy to go lay in the living room on her bed. So changes in behavior and just things that your pet used to do that they don't do anymore, I think are very important.
They really are creatures of habit, and if something changes, then that's often a sign of things.
Yep, absolutely.
So how often would you say then they need to be checked? So I know cats especially are very, it's very hard to tell if there's any change. Because sometimes I see a cat and you can't tell they've changed weight until you put them on the scale.
Absolutely. I mean, at a very, very minimum, every 6 months we should check them, and we do senior lab work at least once a year. And if there's anything concerning, then maybe even change the blood work to every 6 months, possibly every even 2 to 3 months, depending on what the physical exam, weight loss, or anything else indicates.
Right.
But I think a lot of, we're very fortunate because we do have the ability to do blood work, and we have some levels now, especially with kidney values. The SDMA is there, and that can help us identify kidney disease a lot earlier.
Right.
And the earlier you identify any disease, the more likely it is that you can intervene.
It's a big difference.
And it makes a big difference. If you wait till a dog is actually in kidney disease where they're showing signs, then there's really not that much long term that you can do. I mean, you can make them feel better for a short period of time, but if you catch it early, there are prescription diets that actually help slow the progression of that disease down in the event of kidney disease. There are some really good liver supplements if there's liver disease indicated on blood work. You know, sometimes on physical exam, you know, we palpate the abdomen, we listen to the chest, so we may find something that says, oh, let's take some x-rays to see if we can look inside a little bit better.
Right. I mean, diabetes is one thing that people think, oh my gosh, it's the end of the world, but actually it can be quite manageable.
Very manageable. I think I've had several clients that were in a panic. You know, their dog was diagnosed with diabetes, and whether, I don't know how much of it is they think the disease is horrible, or how much of it is, you know, I have to give my dog this shot twice a day. But if you catch that early as well, it's easier to manage, and you know, some of them do well for several years.
Right.
And liver disease, thyroid disease can make a lot of changes in the pet. That you see them slowing down, you see their hair coat change, and that's as simple as a tablet that they take twice a day.
Right.
But the thyroid is responsible for a lot of functions in the body, so it can make a lot of changes as well. Cushing's disease is another thing that we see in older pets, that there again, the earlier you diagnose it, I think the easier it is to get under control.
Yeah, I think it's good to not be scared. He was like, oh, my dog's getting old, or my cat's getting old, I'm scared this is going to be something bad, I don't want to know, I'm not going to take him to the vet. But you should, as soon as you see a change, take him to the vet and say, you know what, check him from head to toe and tell me all the things that is going on here, because he's getting older and I want to see what they are and see what we can do.
Right.
And a lot of those things are very manageable, and we can really extend their life and extend the quality of their life.
Exactly. And I think the key word you just said there was manageable, because a lot of these diseases aren't treatable. A lot of them aren't fixable. They're not going to go away, but they can be managed. Some of them more extensively than others. You know, some of them take more time commitment. Some of them take a larger financial commitment. But some of them are just a matter of changing the food a little bit, or giving the dog, let them out more often during the day, or you know, changing their diet. Just little changes can make a big difference as well. But just knowing your pet, you're the one that knows your pet, and you're the one that knows what's normal for them and what's not normal for them, and being keen on changes for them, I think is very important.
Yeah, we're all going to get old, and we're all going to, I'm going to my doctor in a couple weeks, and he's going to tell me, Jeff, this is normal for you. You are old. These are the things that are going to hurt on your body, and things like that happen. You just have to manage it.